Hey, good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dolph Simons Family Studio. Delighted to be back with you on this rainy, chilly Monday morning, but we're also the home of the AFC champion, Kansas City Chiefs. That's what I'm talking about. Go Chiefs, go, or as Andy likes to say,
I don't know.
how about those Chiefs? All right, it's awesome. Hey, we have a lot to talk about today. Dr. Nathan Barr, who's one of our fine infectious disease docs, he was here with us last week when Doc Hawk was on vacation, is back, along with Kim Dixon, our Assistant Chief Nursing Officer for Ambulatory. We're going to be talking about monoclonal antibody infusion. That's a big mouthful. We'll talk about what that means, what's going, who should be getting it, because it's a big deal in the COVID-19 world. So, Hawk, welcome back. How was your break?
It was good. It was just got to read and relax and enjoy nature. And
I accused you of getting a little sun, and you told me it wasn't from your vacation. It was from the windblown plains of Kansas.
Wind whipping around the flatlands of Kansas for sure. So.
Yeah, well, welcome back. We're glad you're back. How are things going this morning?
They're doing good. I was, surprised to see that overall in the Kansas City area, the 7-day rolling average of new cases has continued to go down, which is a very good thing.
It is a great thing. Okay, just one thing. People, I know you want to have a Super Bowl party. We're hearing text messages about it already, but remember, the rules of infection control do not stop just because Pat Mahomes and the Kansas City Chiefs are going to the Super Bowl. Again. And as one of my very good friends who lives in Western New York, where I used to live for a while, and kept we were texting back and forth. He calls them the Red Devils. Whatever you call the Chiefs, they're going to be Super Bowl champions again.
Yeah.
But it doesn't mean you get to party together without masks. Remember that. Stay safe. I'm sorry, go ahead.
Especially those people in employment where they are together and having work parties at people's homes.
Yeah, bad idea.
Because then everybody gets knocked out from a quarantine.
Yeah, bad idea.
So, but I was happy again to see that the overall numbers of 7-day rolling average of new cases in the Kansas City area has really been going down, which is a great thing. And then, we have been very lucky here in the Kansas City area, especially in our health system, but other hospitals as well, that the numbers haven't been overwhelming like we've seen in those other cities. So today there are 58 active infections with 16 in the ICU, but a majority on the vent with 12 of those on the ventilator. Still 59 patients otherwise here in the hospital with 8 on the ventilator. So that's a lot more than we've had recently still on the ventilator for a long time. So 117 total patients. Hays does have 20 patients, 14 active and 17 in that recovery period. So their numbers are kind of holding steady, but a little bit higher than they were before.
And so we're just kind of staying right here. This is our new normal right now, and it's been that way for a few weeks, which is interesting. We didn't really see the big post-Christmas surge our New Year surge that we were a little afraid of. So I think that's good news.
I think it's great news. And, we were always saying, hope for the best, and we were preparing for the worst as far as critical drugs, especially when you're on the ventilator, for PPE, for workforce and staff to be able to staff those beds. So I think overall we have done a very good job.
Yeah, I think it's been going well. And, look, folks, we got to keep Patrick and the Chiefs safe. Wear your masks. Be careful when you go out in public. Stay in small groups. Keep your distance. Wash your hands. Cough into your elbow. Don't go out if you're sick. All those things we've been telling you, the rules of infection control still apply, and they can still keep you safe. Hey, before we turn to our guest today about monoclonal antibody infusion, let's first of all see if there are questions from reporters. I'm not hearing any. All right. Well, let's talk about that. We're going to talk about monoclonal antibody infusion therapy. This is an outpatient therapy for patients who are at high risk of being hospitalized after testing positive for COVID-19. We want to start our discussion with a look back on Paul Van Arum. You may recall that he was lucky number 13 who received, here's the big word, bamlanivimab. Not bad, was it?
Close.
That's pretty
good.
Close. I thought that was right.
Yeah,
bamlanivimab, following FDA emergency use authorization. Let's see and hear how Paul is doing now.
I was feeling a very strong tightness in my chest, and it felt like my heart, like somebody was grabbing it and squeezing it. The headache was the worst headache that I've probably ever had in my life.
63-year-old retired father and husband Paul Van Aram describes what it was like when he contracted COVID-19.
My wife came down with it first. She had a cough, the tightness in her chest, and she started it about a half a day earlier, and then I was next.
Then his stepdaughter. But it was Paul the family was most worried about.
We've heard the reports that there are people who have long-lasting effects from COVID, and those are things that I don't need to add to my repertoire of things that are wrong with me.
That repertoire includes liver disease, diabetes, and immune deficiency. Those lifelong health issues, however, meant Paul fit the criteria to receive a monoclonal antibody infusion treatment offered to outpatients under emergency use authorization by the FDA.
And they told me, how long it would take and that there hasn't been many side effects to it. We were all good to go.
The one-time infusion treatment, if given early enough after COVID-19 symptoms arise, can help reduce the risk of severe illness and hospitalization in those with other high-risk health factors. Paul felt better within a day.
My chest wasn't as tight. The heart issue wasn't what it felt like before, and my headache was gone. And then the very next day, I was back in my shop doing my woodworking and being very, very active.
When asked if he felt brave for trying something new that might help him and so many others affected by COVID-19,
I didn't feel like I was being brave at all. This is an opportunity for me to make sure that I'm here for my family and that I don't have it long enough to have it cause irreversible issues.
That was a great story, Dana. Let's turn first to Dr. Barr. I noticed that he had a bag of Famous Amos chocolate chip cookies, one of my personal favorites. Nate, was that a critical part of the infusion?
Oh, I'm certain it was, yeah.
So is Paul's outcome typical, folks who get the monoclonal antibody infusions, Nate?
Yeah, most people do pretty well with it. Side effects are thankfully pretty rare, and there does seem to be some benefit. It's the studies. We just got a more substantial study on the bamlanivimab, but the studies do show some benefit, particularly in decreased hospitalizations, decreased ER visits. So that's really what we're excited about with it, is that we can potentially help people stay out of the hospital. And it's really the high-risk patients, the people that are high risk for hospitalization, and even people that are high risk for death, that are eligible for this type of infusion. And so we're excited to be able to help those people stay out of the hospital potentially.
So how do these work, Nate?
Well, basically, these are very specific antibodies that these companies have derived. There's a long process they go about to find sort of the best fit type of antibodies, and the bamlanivimab is a single antibody. The Regeneron product is actually two antibodies, but they're both very specific for the virus. And the idea is, if you get these to people that aren't generating their own antibody response yet early on, then it can actually stop the virus from replicating and really hold back on some of those more severe effects of the virus, because we're able to stop the virus from propagating more.
So it's really important to give this early, because you don't want to wait until you're really sick to get it, because by that time the horse is out of the barn, so to speak. But in this case, the earlier is the better, as I understand it. These are antibodies your body would otherwise make, but you're getting them because your body takes a while to gear that up. Yeah. And so you get the antibodies really early. Is that right?
Yeah, that's exactly right. And most people are able to make their own antibodies, provided they don't have some form of immune suppression that stops that, right around a week or a little past that. But if we can get these even earlier, this is a way to sort of passively pass that immunity to a person, and can actually sort of jumpstart that process and help them get a control of the virus.
Yeah, I think that's so important, because we know that people do pretty well, and it looks like this does help prevent hospitalizations.
Yeah, the studies show a trend towards that, I guess would be maybe the best way to say it. These are sort of early data for the most part. And, thankfully, there weren't a massive amount of hospitalizations in these studies. And so whenever you're dealing with a small amount of events, it's just harder to show that it works definitively with statistics. But they're definitely a really strong trend that way. And, it's very encouraging. And, in our population, we're seeing, I think, less than we would expect go to the ER or to the hospital with these, again, very at-risk people.
Okay, so let's hear you say the word one more time.
Bamlanivimab.
Bamlanivimab. Okay. Now, can you just say Bamlan? Is that good enough?
You're the boss. You can say whatever you want.
Good answer.
Wow. Okay. Kim Dixon, let's talk with you for a moment. Some of the challenges of providing these therapies, because this is not a common therapy that everybody's doing.
Yeah, it is a challenge. I think really one of the biggest challenges is that time frame that you guys talked about. We have to infuse this within 7 days of symptom onset. And so many people, it seems like they wait, a day or two before they even go for testing, and then possibly waiting another 24, 72 hours longer for that test result to come in. So you're really getting into just a few days, to be able to get that infusion in. So that's one of the biggest challenges. And it's the one thing I always say is to try to test early so that you have those opportunities available to you for treatment.
Yeah, test early, test often, or something like that. So Kim, talk to us about what is the process for actually having to give the drug? How long does it take? We saw the video of the famous Amos chocolate chip cookies, and then there was something in the arm, too. I'm not sure what that was about.
Yeah. So as a patient arrives to the infusion center, we get the IV started, and then the pharmacy is preparing the medication. The infusion itself takes about an hour, and then after the infusion, we do an hour of monitoring before the patient is able to go home. So it's about a 2-hour visit with us at the infusion center.
Yeah. So, but I know you guys keep it light. People do a great job. I've sent a number of my own patients out there. I think I've had 4 or 5 of my patients come through. And I just want to say they've done very well, and they are all, Kim, highly complimentary of the process, how they're treated, how nice folks are. They don't feel like they're scared or whatever. It goes really, really, really well. And when folks are sick with COVID, that is such an important thing to have that positive experience. So tell us a little bit in general. What are the criteria for use, and do you think those criteria are going to change at all?
Yeah, the criteria for use, there's a set of criteria to even first be evaluated for it, and that is that you have to be greater than 40 kilograms. You have to be older than 12 years of age. Again, within that 7-day symptom onset is very important, and you have to be confirmed with mild to moderate symptoms of COVID. And you cannot have increased oxygen needs. So that's important too, as far as the oxygen level goes. But many of the patients are having increased shortness of breath. They can't be hospitalized. I think we've talked about that. They can't be pregnant or breastfeeding. And also they can't have a history of SARS-CoV-2 antibodies. So it's important. This is really to treat that true active infection, not a past infection. And they also cannot have received any of the convalescent plasma as well. And that's kind of the initial baseline screening criteria. Then we have our advanced practice providers do a further screening, and this is really looking at the patient's medical history. So if they're over 65 and they have active cancer, if they're over 55 and have chronic lung disease or have chronic kidney diseases, hypertension, cardiovascular issues, then they meet the criteria that we can do that infusion.
So, Kim, now we can give this in the emergency room as well. So talk to us a little bit about how that goes.
Yeah, we can give it in the emergency room. So what we've been working on with our emergency room physicians, and they're very, attuned and know what this criteria is. So if they feel like the patient does not meet that criteria for inpatient admission, which a lot of times is centered around that need for oxygen, additional oxygen, they will get the COVID test taken, and sent to the lab. Once we get that confirmatory positive COVID test, then they can go ahead and start that MAB infusion, the monoclonal antibody. And then what we also are working on is being able to do a rapid test in the ER, and then we'll do a confirmatory positive PCR. But once we can do that rapid test, we can really get that infusion started in a very short time frame. Most of our ER visits right now have been patients that have already been tested COVID positive and are coming to the emergency room because they're seeing an increase in their symptoms and want to be evaluated. And with that, we were able to go ahead and start that infusion right away.
Yeah, that could be a good thing, huh? So, Nate, do you see the criteria for this drug expanding in terms of its use going forward in the
Yeah. We have done a little bit of that as it's went along. As we get more data, we certainly reevaluate our criteria. Part of it, initially, we were concerned about supply, and we have enough supply, thankfully, so that's not been a problem. The other thing that we've sort of dealt with on the fly is just as vaccinations have become available, we've had to consider how those will fit into all this as well. So we certainly, will adjust as we need to. This most recent study in JAMA actually had a little more broad criteria than the initial studies did that were published. And, one thing is we are having to relate this to that emergency use authorization for both of these antibodies. And so we certainly aren't going to be able to go any broader than those allow. But, we really want to make sure this is going to people who are likely to benefit. We don't want to be giving infusions to people that are very unlikely to benefit from it anyway. So that's why things like, the timing is really important. If you've, had a recent infection and been given plasma or something like that, people that are very unlikely to benefit, we don't want to give a drug to if we don't think they're likely to benefit. But we do want to get this to anybody that we think can benefit, because there's a potential really good benefit for them staying out of the hospital.
But Kim, how do patients advocate if they want to try and get this therapy, see if they're qualified? What are the steps they take?
Yeah, I think the big piece is to know, right, all the different treatment options available, and then really to, if they test positive, to ask their primary care physician about the possible, infusion of the monoclonal antibodies. We do allow people, encourage people to call the hotline if they have questions, our 588-1900 phone number, and we can talk patients through that. We do screen every patient that has a COVID test here at the health system. We do that initial screening automatically. And as we call those test results, we do let patients know that they are potentially a candidate if they meet that criteria, and then they can go on to our screening. But I think the big part for patients to advocate for themselves is first to know the treatment options and to ask their primary care physicians about it.
Hawk, I think this is a really important therapy in the landscape, and it feels like we talk so much about vaccine, we just don't talk as much about monoclonal antibody therapy. But I've been so impressed, at least in the patients I've got, how much better they were right afterwards.
Yeah, absolutely. And we have given so many doses here relative, but we've had very few people who've come to the hospital and even gone to the emergency department after that. And Dr. Barr has done deep dive into those patients, and some of them weren't even here for COVID. So we've had a pretty good result of people who have gotten the infusion and not had to come into the hospital. And just as Dr. Barr and Kim talked about, we want to give this monoclonal antibody to those patients that are high risk for hospitalization and complications. So we are trying to screen out for those highest risks, and that is why the criteria are there. Age, other comorbidities, things of that nature. So I think we've had very good response to giving it overall in that population that we've given it to.
Yeah, I'm impressed that it works, and I think that something for people to remember if they're positive, they're short of breath, and they can check with us and see, call that number 588-1900 and see if they're a candidate. I know Liberty Hospital is doing it. I don't know all the other hospitals who are doing it.
Yeah, I think North Kansas City is. Research or the HCA system is as well. But we have to remember, it is very important because some people will have symptoms for 5-6 days and then go get tested, get the result a couple days later. So it's extremely important that you get this, because just with any infection, it takes time to build up antibodies. Even with this vaccination or influenza vaccination, it takes 2 weeks to build up antibodies in response. So what we are doing is providing those antibodies prior to your body making them, just as you alluded to in the beginning. So that's why timing is so vitally important here.
Yeah, I think Luke's must be doing this, and I thought Event was too. So they are available in the city, but you do be your own best advocate. Don't not think about this, because it is important therapy if you test positive for monoclonal antibody. We also want to take a moment, or test positive for COVID. We want to take a moment and remind you there's another trial underway here at the medical center for more antibody monoclonal therapy drugs. So we have the two that are approved under an early use authorization, and there is a trial now here at KU that Mario Castro spoke about before. These trials are open to more people of more ages. There are criteria for people who are aged 18 and older. The study is seeking patients who have tested COVID positive within 10 days and have active symptoms along with other health issues like obesity, lung disease, asthma, cancer, or HIV. You can see the full screen there of where to call. Call Luigi at 913-588-4022 to see if you meet the criteria. We want to see if these other monoclonal antibody drugs can stop the disease process and prevent hospitalization. The study is designed to quickly, safely, and effectively study these drugs that might be able to treat COVID-19. So, Jill, so many developments in the world, and some more evidence coming out today. Pfizer said that their early-stage vaccine trials don't look as effective. That's not a big surprise, Hawk. No. But they have two viral therapies that might be effective, kind of like a Tamiflu for COVID. So that would be good. So we'll see how that story plays out.
Yep. Yeah, we just need to continue to track it. There is, again, Operation Warp Speed with the vaccines that came to market so quickly, or EUA so quickly. We know that there are a lot of resources, a lot of good minds behind all this, and hopefully we will continue to get better therapeutics as well.
And since I've got my therapeutic guys here, also some data coming out that Moderna is announcing they may produce a booster to the South African variant. Their shot was still effective, but they want to make it even more effective. They may even combine it. So I think that's good news, because that shows our ability to pivot if we need to. Dr. Barr?
That's, I think, one really neat thing about this technology, these mRNA vaccines, is that sort of thing can be done pretty rapidly. That's something that would be a lot harder to do in the past, and I think the fact that they can sort of rapidly see these variants come and say, we think it might benefit from a booster, that's pretty neat. So, obviously we want to make sure it's still safe and all those sorts of things, but I think it's an encouraging thing with this type of vaccine that can even be done.
Yeah, I think these new vaccines are the Patrick Mahomes of vaccines. Throw a little variant at me, no worries, I got you covered. Here we go. All right, Jill, let's see what questions we have out there from the community.
Yeah, everybody's awake after the game, and we have lots of questions coming in. Jeannie wants to know, if a vaccinated person gets the virus and the symptoms are masked by the vaccine, could the virus still cause long-term damage to the heart, lungs, and other organs?
What do you think, Hawk? What's the data on that so far about patients who get COVID-19 after they've had the vaccine?
Yeah, and we know that happens, and they looked at this in the studies, and they were looking at people who were getting the vaccination, especially their first dose, and then within that 7 or 14 days who actually get the virus and get the infection. So we know that happens. We would hope that you would have, number one, less pronounced symptoms, and then therefore be at less risk of those chronic or long-hauling symptoms as well. We don't fully know, but we do know that people were getting infected after that, especially that first vaccine dose. There were some who were getting infected after that second, but it's probably going to be even less symptoms after that second. So that is not unheard of. That was studied, that was looked at. We don't know what exactly the consequences are. If it's maybe 7 days after that first dose of vaccine, you probably have some sort of immunity built up, and therefore are able to attack the virus a little bit better and reduce your chance of symptomatic disease and then those long-term consequences as well.
I think it's pretty clear that vaccination will help you not only get as sick, but it will help you not have those other parts of the disease, because those other parts of the disease are what make you so sick. And so if you're not getting sick, you're not going to get the heart complications, the lung complications, the brain complications. And so I just think vaccination is really so important, along with monoclonal antibody therapies and hopefully oral and inhaled therapies that serve as kind of an immediate drug to help decrease the effects. Jill?
Angela is curious if we think the monoclonal antibody treatment will work against the new variants.
Great question. What do you guys think? I'll turn to Nate there. He's shaking his head yes.
No, well, I'm shaking my head to a good question.
Okay.
So these are really specific antibodies that were developed to the strains that were out there. So I think it's to be determined a little bit. It depends on exactly where the mutations are relative to where the antibody is. And so in particular with the South African variant, I wonder a bit about that. But I think that's to be determined. In the meantime, thankfully these aren't the dominant variants here at the moment. They some of them may be here. We don't know. We haven't found them. But I would say to be determined. I have no doubt that sort of work is rapidly being done by these companies because they want to understand that too.
Yeah, so Hawk, the South African variant, when we talk about the variant, what does it really mean? What makes the South African variant different than the UK variant?
Yeah. So again, we understand that coronavirus does mutate and has changes in the genome, and then when new viruses are created, those changes in the RNA, the genome of the virus, cause amino acid changes to be formed. When the amino acids are changed, the conformation of the proteins that those amino acids make, i.e. the spike protein, is changed. So just as Dr. Barr said, they are very specific. These antibodies, our immune system is amazing in the fact that it can make such specific antibodies to these infections that we see. There have been a number of variants that we've identified. Again, the most concerning one right now does seem to be that South African, because in those amino acid substitutions, which the UK variant has, as well as the South African, and they do have other names. They're kind of wanting to go against the country where they're identified, but we'll continue for right now. There's an amino acid change at position 501. That doesn't look to have as many problems as the South African variant, which also looks to have another substitution at the 484 amino acid. And so that just changes the way that this spike protein looks. And that seems to be what is one of the most concerning. And remember, these variants are also associated with anywhere from 15 to about 20 other mutations as well. So right now, it seems to be that 484 position of that amino acid that is changing the spike conformation and how it looks to our body in such a way that the antibodies that are created may not be as effective as with other variants or strains, if you will.
So I think it just means that things like Moderna and Pfizer, Moderna and, BioNTech, the AstraZeneca vaccine, the Pfizer and the Moderna vaccines are so important because that means that they will be able to shift to those messenger RNA delivery vehicles. So talk to us a little bit about how that works.
And I would like to say, too, we understand that coronavirus and this virus mutates. That's why, just as Nate talked about, Regeneron has two different antibodies because they identified another antibody when they were doing their research, that is why they produced a cocktail just in case there was an escape variant or something of that nature. So it's just they're able to identify through the genome itself, just through the sequencing, then create new proteins, and then when they create new proteins in the lab, able to package those into the nanoparticles and then hopefully give it as a vaccine. And that really takes not too much time compared to what we've seen other ways that vaccines are created. So they are able to do it in a relatively short amount of time just based on the sequence itself. If these inactivated vaccines, these inactivated virus vaccines are proven to be efficacious, and I think Russia has one and China has one, don't look to be as efficacious as the Moderna and Pfizer mRNA vaccines. But if they are, basically you have to inactivate the virus. The problem with that, though, is you have to grow up so much volume, such high levels that it's very difficult to do that. The nice thing about the Moderna and Pfizer is they are able to create large amounts of these vaccines in a relatively short time as well.
So good. All right.
Loretta wants to know, after having COVID, should one wear a mask? Can you still transmit COVID?
Can you transmit COVID and should you still wear a mask, Hawk? I think you should.
Yeah. I mean, the best evidence that you can transmit it is probably, we don't know for sure, but if you are reinfected with COVID or have COVID again after having it once, you probably have some immunity. You are likely as an individual going to be less likely to have symptoms and have to go to the hospital, but we know there are people who have reinfection who have worse symptoms and have to go to the hospital and have bad outcomes as well. But the main answer to this is yes, you continue to have to wear a mask, because even after the vaccine or after a previous infection, if you do encounter the virus again and have infection, you can probably still have enough replication going on in your upper respiratory tract where you can spread the disease.
Yeah, we still want you because it can still be a danger. And so, Kim, in our clinics and even in the infusion lab and everywhere else, we really work hard in infection control, even in the vaccine clinics now. So talk to us a little bit about some of our principles. How are we doing? Have we had patients get infected in our facility?
No, we haven't had employees get, infected, and it's because we do a great job of making sure our staff are wearing their PPE. If they're dealing with patients, they're wearing their eye goggles, their face masks, doing great hand hygiene, trying to do social distancing. And even in our vaccine clinics, we're working hard to ensure as people are waiting to receive their vaccine that we're maintaining that 6 feet of distance, and all of our staff are wearing the appropriate PPE. And patients coming in all have to wear their masks as well. We are screening as patients come in to make sure they're not having a fever or any symptoms, as well. So doing a great job with that.
All right.
Yes, okay.
I caught you off guard because I came back to her so
did.
quickly this time.
There's a couple of people that are wanting to know, Wendy and Terry, is it safe to get the vaccine with the tight chest and heart squeeze? There was the man in California who got the disease and died within hours after getting the vaccine.
Yeah, I just saw that. That was reported today. I was reading about that. Did you see that?
I did
Nate,
not.
did you see that about the vaccine? Can it cause death? Or there was somebody who I suspect had COVID early. They didn't know he got the vaccine, and then he turned a big positive. It sounds like he had a heart attack, actually.
Yeah.
And so I suspect it's true, and unrelated, meaning that, yes, he got a vaccine. Yes, they had a heart attack. Those two things aren't related, because when you've given the vaccine millions and millions of time, which now has happened with both vaccines out there, when you've given it millions and millions of time, you're going to have people have routine events that life would have otherwise had.
Yeah, I don't know that report. I didn't read that report this morning, but there have been a number of reports out there of just people that have gotten a vaccine dose and at some point subsequently have passed away. Everything I've seen, very thorough investigations of those deaths, it's been very clear that these were not related to the vaccine and that they were related to underlying medical conditions that occurred either, acutely or in many cases actually chronic medical conditions that had worsened to the point of being terminal illnesses. So all the data out there really still saying very, very safe. I'll of course read this report too, as we all do with all these when they come through, but I'm really reassured so far on the safety.
And Kim, we've given, I think, like over 8,000 doses of vaccine now. How have patients done with that vaccine? What kind of problems have we seen?
Yeah, we've actually given a little over 10,000 vaccines as of this morning. Patients have done well. We've had a few mild reactions where we're given a little bit of like Zyrtec and some antihistamines. But for the most part, that's been reported that we're seeing is, the sore arm and a little bit of fatigue and really, the day after have been the biggest symptoms that we've been told about.
And I would like to say, too, for the most severe reactions that we've heard about, and that's the anaphylaxis, further studies now have documented that it's really only about 2 cases per 1 million doses of vaccine. So it is very rare that those things happen as well, even though they get a lot of press. 2 cases out of 1 million is not very much. So it's very exceedingly rare.
Yeah, I think actually if you were talking about other drugs, and let's face it, a vaccine's a drug in many regards, right? So if you were talking about other drugs and you said that this is the side effect profile and it was this low for a therapy that's life-saving, we'd say, let's go. Yeah. Or as Andy Reid would say, let's roll.
Marcia and Isaac want to know if the Bam Lam is being used as a prophylactic, and is it being used in nursing homes?
Yeah, because I don't think, Hawk, we can really use it prophylactically.
I think they were doing some initial studies on that. We'll let Dr. Barr elaborate on that a little bit. But they are also looking at in nursing homes and recent studies coming out in nursing homes, not necessarily as a prophylactic, but after a positive test. So, but that has been looked at. Nate, if you wanted to add anything.
Yeah, the company just released a press release, I think, I don't know, either Friday or over the weekend. I mean, it's very recent. And they were using it in nursing homes as a prophylactic, actually. And this is very, very recent, and it's only a press release. So, we need full data and things like that. It isn't something that is covered with the emergency use authorization yet. So, even if this is all confirmed, you need that before you could actually give it this way. But it was a positive result in the press release. They did show that they were able to prevent disease. People that got the antibody were getting less disease than people that did not. And, this is particularly appealing if there are facilities out there that aren't able to get vaccine, as we continue to need more and more vaccine. If there's skilled nursing facilities with high-risk populations that can't get that, but could get this drug, that might be exciting. But we need the data, not just press release, and we also need the FDA to review it thoroughly, and they would need to feel that they can do an emergency use authorization. But yeah, some encouraging, very recent news, and we'll have to see how that pans out.
Yeah, that is, but I don't think we all want to go around getting monoclonal antibody infusions. Better is to wear a mask.
Yeah, I think so, and I think we do have to develop criteria if that. So again, in their early studies, they were looking at that. It sounds like the press release is there. We'll wait for the data, but it doesn't mean everybody in a nursing facility is getting bamlanivimab every 60 days or 90 days either. So I think you have to pick select populations for that. For instance, if you've had 1 or 2 cases in that facility.
All right, Jill, a couple more questions.
Sure. Mary Ann, she had seizures after having the pediatric pertussis vaccine, and Jennifer's mom is highly allergic to shellfish, and there are several that want to know, are there any reasons why I should not get the vaccine that would preclude me?
All right, Nate, I can't think. I think those are all safe with this type of, with the mRNA vaccines.
Yeah, and CDC actually just Friday updated their website with a lot of really detailed vaccine information. I think folks that have those sort of questions would actually find it really helpful, because they specifically address things like food allergies and things like that I think a lot of people are having questions about. So I would definitely encourage people to do that. But yeah, I don't see a reason in either case that you couldn't go ahead with the vaccination. But definitely look at the CDC website. They are rapidly updating things, and Dr. Rochelle Walensky's great communication skills are coming across.
Yeah, that's awesome. So, Kim, once again, we've not sent anybody to the emergency room after one of our 10,000 doses. Is that right?
No, we have not. We have a medic that we keep there in our vaccination clinic just in case we need to, so they can evaluate and decide if we need to take anybody to the emergency room, and we've not had to do that.
Yeah, so it's pretty darn safe. And Hawkeye, you're going to be getting yours again here pretty soon. We're going to talk about that in a moment.
Can't wait.
Stephen said that during the video, the patient had 1 mask on and the nurse had 2 masks on. Should we double mask?
Oh, Kim, what do you think? That was a pretty good catch.
It was.
That's even better than my famous Amos chocolate chip cookies, which I love to eat and drive with.
Yeah, I didn't pick that up either. No, the 1 mask, all of our, PPE that we have are appropriate. The double masking does not, is not needed. So that's a good catch. I didn't notice that on the video.
Yeah, well done. But it's not, people can double mask. Some people do, and that's okay, but it's not something that we recommend. All right. Well, team, let's kind of wrap up this morning. And we've had a great discussion so far, and a couple of things that we want to talk a little bit about. So tomorrow, Hawkeye does roll up his sleeve again. He's going to get his 2nd dose of the Moderna vaccine live here on the air. You don't want to miss that. And just so you also know, KDHE Secretary Dr. Lee Norman is back to answer questions about the vaccine rollout and everything else. We get to pepper Dr. Norman with the vaccine. As you know, he used to be the former chief medical officer here at KU as well. So he and I share a special bond, and I'm happy to give him a hard time. That'll be fun. All right, Nate, final thoughts.
Yeah, well, a few things. Congratulations to the Chiefs, and the still infection control advice, despite that win, continues. So, I know everybody's excited about that win, and as the Super Bowl comes up, please make good decisions. Please limit gatherings to small gatherings, wear proper masking, and don't make the Chiefs Super Bowl victory in the future an excuse to skip a mask.
All right. Well said. Kim Dixon.
Yeah, I think, same things. I think it's make sure we follow our, pillars of infection control, wear that mask, good hand hygiene. In spirit of talking about the monoclonal antibodies, I think it's important to remember test early, if you're having symptoms, and that way you have potentially some other treatment options available to you.
All right, Hawkeye.
Yeah. I'd like to echo, what Nate said. If you see any Chiefs out there on the street or walking around shopping, please stay away from them. Keep everybody healthy. If you are going to hold a gathering, please keep it to your bubble. I would not encourage anybody doing gatherings with people they work with. Therefore, if somebody is infected or gets others infected in that office space or anything, the whole office could be down. I would just like to say, Kim has been great since the first days of all
Kim's going to
this.
be in the next edition of Superwoman.
I mean, she is available 24 hours a day with text messages about whether it's monoclonals or vaccine or everything. And, she's been going since March, essentially. And Nate, thank you very much for that excellent job you did last week. It's good back reading the numbers and stuff, but thank you for that as well.
Yeah, though we have a great team, and we're delighted. Thank you all for being with us today, and thanks to Patrick for staying masked. And wait a minute. Patrick does stay masked.
He
and
does.
The whole Chiefs team stays
They do.
masked. And you know what? They've stayed healthy.
Yep.
So there should be a thought for that to you, because we don't let the Chiefs go out and party, and they have fought for their right to
they fight
party
all the time.
but they're not doing it. And why is that? Because they got to stay safe. The Kansas City Chiefs have also led the nation not only as a Super Bowl team, they've also led the nation on how to be safe at a football stadium.
Yeah.
The Chiefs were the first team to open up their football stadium. They have done it very safely. I mean, the county and the city and the Chiefs deserve a special call out because they've been able to keep fans safe. They make sure they don't have the full crowd. They socially distance. They try to keep people wearing masks. And I noticed every time they cut the crowd, most people wore their mask. I saw one person have their mask off, and then she put it back up. I was like, yes, at least she put it back up. That's how you can stay safe. And when some fans get to travel to the Super Bowl, they can stay safe because we've proven you can do it in the football stadium. We've also proven it at KU on an opening of a campus. The rules of infection control work, and so while we all wait to get vaccinated, while we have monoclonal antibody if we get sick, or if we're COVID-19 positive, and there are other future therapies that we think are going to be really exciting. In the meantime, the most powerful thing you have to do is what you can do. So don't forget to wear your mask, keep your distance. Don't go out if you're sick. Cough into your elbow, wash your hands, and most of all, remember there's still no place like home. So what a weekend. What a victory for the Chiefs, and what a great emotional shot in the arm for this area for our pandemic. As we sign off, we want to share some of that Chiefs spirit that is alive, well, and rooting our team onto the Super Bowl. So be like the Chiefs. Stay safe wherever you go.
Super Bowl down! Super Bowl down! Super Bowl down!